With me in the studio today is Dr. Some Onoha, a medical practitioner and a child of God to the core. Welcome to the Pew and Pulpit. Doc, how are you doing?
Thank you. I'm doing well.
Okay. This program is aimed at educating Christians and pastors and everyone that cares to know about Christ. We believe that as Christians, we can not only focus on the Bible, we can as well talk about our health. And so today, Doctor, we want to look at seizure. What is a seizure or an epilepsy?
Thank you very much, viewers. Welcome again. We're going to talk on a slightly different topic today. We're going to be looking at a seizure disorder, and like the Venerable mentioned, he mentioned seizure, mentioned epilepsy. So let's make it a little more academic. So these two things, sometimes we use them interwoven, but they're two different things. A seizure disorder, it's a sudden or brief, involuntary and abnormal discharge in the brain. Abnormal electrical activity in the brain, which is sudden, brief, leading to a disturbance of feeling, movement, behavior, or awareness. So, there is electrical activity that is unusual or abnormal in the brain, and it manifests in any of these ways. That is a seizure. Epilepsy is a clinical diagnosis and a syndrome. When you have repeated episodes of seizures, you're said to have an epileptic condition. So if you have epilepsy, which is the condition, it increases your risk of having seizures. In a nutshell, this is what this is. And again, this is a very old disease condition that is as old as man. It dates back many centuries ago. And epilepsy, like I said, epilepsy, seizure, febrile convulsion, people use many terms. A convulsion is just like a seizure. Epilepsy is the clinical syndrome and the diagnosis. And if we go through the spectrum, we'll know that little kids, when they have fever, sometimes they end up having convulsions. And sometimes people may erroneously feel this child has epilepsy. We don't call it an epilepsy at that time, it's just febrile convulsions. Epilepsy is when the seizures become repetitive and when we do not find any other reason for it. Thank you.
Thank you. That was a brilliant one, Doctor. Here, I have a second question. What causes seizure?
Okay, so seizure disorders, like simply put, there's an abnormal electrical discharge in the brain. This abnormal electrical discharge could be one, because of a primary disease in the brain, and it again could also be due to some other reason, something happened extraneous to the brain. So in the brain, you know, the brain is a very delicate organ. So if there's trauma to the brain, what happens is that this interconnection of wires, neurons, which are neurons in the brain, if there's any disturbance, the transmission is impaired. And when this is impaired, it could lead to a seizure disorder. So that's one way of having a seizure disorder. Another way is something extraneous. So there could be a toxin in the body that goes to affect the neuronal function. This can also lead to a seizure. Infection in the brain, commonly meningitis, which is inflammation of the meninges, which is the outer covering of the brain. This could also lead to seizure. Tumors or any growth in the brain, like we mentioned that the brain is inside the cranial cavity, the skull closes up the brain, and anything that causes pressure on these neurons could lead to a seizure. Medications, so some medications can lead to seizure through so many ways. Some medications reduce the seizure threshold. When we say seizure threshold is, they reduce the level at which you develop a seizure. So simply put, if somebody has epilepsy, which is a condition, a syndrome, like I explained, that person has a reduced seizure threshold. When the threshold is low, means there's more likelihood of that thing occurring. You don't have much reserve. So that means any little thing could tip you over into having a seizure. So some medications reduce the seizure threshold. And when this happens, they increase the risk of you having a seizure.
Oh, thank you, Dr. Some. That was great. I want to know, do we have different types of seizure, or is seizures all seizure? If we have, what are they?
Okay, so like I mentioned, there are different types of them. And like I mentioned, febrile convulsion is just a very, very common one that we know. That we see little kids, especially below the age of 5, they have fever and they start convulsing. So that's a type of it. But in the broad definition or classification, we try to classify them different ways. So sometimes we classify them by the part of the brain that is affected, and the other classification is by the features of the seizure when it happens, what part of the body is moving, and so many other ways. So let's just take two. First, the part of the brain that is affected. So we have what we call simple and complex seizures. So simple seizures means seizure. This is a seizure that is starting in one area of the brain and remains in that area of the brain. So there's an abnormal electrical discharge in an area of the brain which is localized or confined to that area of the brain. So that we call a simple seizure. Complex seizure means there is disturbance of neuronal activity in more than one area of the brain or several areas of the brain. This is now a complex seizure. Another way to classify it is whether there is loss of consciousness or no loss of consciousness. So that way we say a seizure is partial or generalized. So partial seizures means you are awake, you are conscious. Generalized, you are not conscious. Then the third way of classifying it is by the activity of the seizure disorder. What happens? What is the movement or what is the observation? Remember, we said in a seizure activity, you have an abnormality of the feeling, the movement, the behavior, or the awareness. So we watch these things. So generally, we all know in a seizure disorder, what we notice, what everyone notices is that there is either jerking of the muscles, okay, or the muscles go into spasm. What happens is they take an unusual posture. You can see somebody, they straighten out their legs or straighten out their arms. Some they just have a blank stare. They're just looking at you as if they can't make out anything, and you call them, they don't answer. So these various forms of behavior help us classify them. So going that way, we have what we call generalized tonic-clonic seizures. That's the one we all commonly know, where somebody, you see them, the muscle stiffens up, they contract their muscles, and the next thing is they start shaking. So all over their whole body is jerking. This is generalized tonic-clonic seizure. It's a very common type of seizure. You have the tonic seizures, so where they just contract the muscles as if they make a fist and they remain that way. And you have the clonic seizures. Then apart from these ones, generalized tonic-clonic, you have tonic seizure, you have clonic seizure, then you have the absent seizures. Absent seizures is where you now see these people, it's blank stares. Somebody, you're talking to the person, and all of a sudden, the person starts staring at you. He's not saying anything, and he's not responding to you. It could last a few seconds or a few minutes. That's the one we call absence seizures. So these are the different types of seizures that we normally see. But these seizures, one thing is that a seizure normally lasts few seconds, few minutes, less than 5 minutes. It normally doesn't go beyond 5 minutes. When it goes beyond this way, there's something we call status epilepticus. Status means prolonged seizure. This is very bad, and the complications are usually enormous because, remember, this abnormal electrical discharge, especially when they are generalized, it means the whole area of the brain, the function is being compromised. Remember, the brain controls your breathing, your respiration, you're going to the bathroom. So when this function is compromised and the whole brain is compromised, means even your breathing is being compromised. The brain cannot be starved of oxygen for significant period of time, length of time. Because what happens is that if you starve the brain of oxygen, it becomes anoxic. That is, the brain could die. So when somebody has seizure episode that is lasting more than 5 minutes, we get so worried. So in a nutshell, we can classify seizures in many different ways. One way is by what area of the brain is affected. If it's one area, we say it's a simple seizure. If it's many areas, we say it's a complex seizure. And loss or maintenance of consciousness, that's another way to classify it, partial or generalized. And another way is by the features of that seizure. So whether it's generalized tonic-clonic, whether it's tonic-clonic, clonic, tonic, absent seizure, or status epilepticus. I know these are so many names, but the commonest one we know is the tonic-clonic seizure, where you see somebody, their muscles stiffen up, and they are jerking, and they are foaming from their mouth, they are urinating on themselves, they're defecating on themselves. This is the commonest one that we see.
Yeah, doctor, thank you. Indeed, I think this is a very interesting topic. You see, in our society today, people are cajoled, people are mocked at, ridiculed for having seizure. What do you think is the social implication of seizure? And again, can someone live with seizure and still live a normal life? Is it a disease that, is it incurable? And if it's incurable, how do people who live with it, how are they supposed to live?
Thank you. Unfortunately, seizure is one of the stigmatizing disease conditions. So this is oftentimes in crowded situations, a church being one of it, somebody may just fall down in a seizure. And you see what happens is that there's an area of clearance, because there are so many myths about it. Some people believe, well, the foam from their mouth touches you, then you're going to develop epilepsy. And people take on their heels and run away. Some believe the air from there, or you're going to become epileptic. And if it's the women, they say, if you're epileptic, nobody's going to marry you. You know, all sorts of things people say and believe. But one thing is this. A seizure disorder depends on, is it primary or is it secondary? If it's secondary, means there is some other thing that is causing it. Once you treat that thing, it's more or less cured, because it's not happening again, because something led to it. Somebody could just be as simple as an alcoholic. He's intoxicated and he has a seizure. If he stops drinking alcohol, the seizure will be gone. So yes, secondary seizures you can treat. Then primary seizures, somebody has an inherent problem in the brain. It could be a tumor, which is a growth in the brain. You surgically remove it. Yes, you can treat it. Unfortunately, some people have a seizure disorder, which we now group as epilepsy, where you can't find out the reason why they have it. So in this scenario, what you now do is you have to almost perpetually treat them with anti-epileptic medications you use to treat seizures. So are there treatments? Yes. If it's secondary, you treat whatever is the primary thing causing the seizure, and that's more or less cured. If it's primary, that is a problem that's coming from the brain itself, in other words, the person has an epileptic disorder or epilepsy, then you treat the person. There are various forms of anti-epileptic medications that we use. They are very efficient. 80% of seizures can be controlled with medication. And when we say control, really control. There are many people in the developed world who have a seizure disorder, and they'll tell you the last time they had a seizure was the very first one they had. They've never had any other one, because they're on medication and it's controlled. And these medications, I know, we're always worried. My patients ask me, Doc, is this it? I'm going to take this all my life. Seizure medications can be stopped. If your seizure is controlled for more than 2 years, have a discussion with your doctor, you can start coming off the medication. Now, some people, we advise them not to come off the medication, because the risk of them having a seizure could be so catastrophic. Example is if you're a pilot and you have seizure. If you go off your medication, imagine having a seizure when you're in the air. So such people, we advise them to be on it for life. So some people will have to be on it because the risk of them not being on it could take many lives. But the social stigma of it, seizures can be controlled, they can be treated. If it doesn't stop, if you're a woman, it doesn't stop you from being pregnant, because there are medications you can safely take during pregnancy. And no matter the type of job you do, these seizures can be controlled. So there's no need for the stigma.
Yeah, doctor, is indeed. Thank you for throwing light and more light to the stigmatization of seizure. Growing up in Nigeria, I grew up in a society where people run away when they see people with seizure, like what you mentioned, when they start foaming. There are all kinds of theory that if you touch them, at one time I even heard that if you touch them, you will be epileptic immediately. But with this, you have educated the public not to stigmatize people with seizure. It's a condition. Nobody prays to have such condition. And Christians too do have it. As a Christian, don't think that you are free from getting sick. You can get sick. It is not demon. It's not everybody that falls in the church during church program or services has demon. Sometimes these are health conditions that comes like they didn't bargain for it, they didn't buy it, they didn't ask for it. It's just there. And sometimes, like the doctor said, most people may die with it. At one point, God can still heal people, but we don't want you to be ignorant about your condition and you just hope on prayers. So when you pray, also do the necessary thing to see your doctor. Doctor, does it have treatment?
Yes, there are several treatment options. So first thing, like I said, if there's anything that is causing the seizure that can be treated, we treat it. And if we see that there's nothing causing the seizure, is somebody who has a primary epilepsy, then there are medications. These medications, there are a whole lot of them. We start, but these medications, unfortunately, some have some side effects. So treatment is always individualized. The treatment you give to a male is different from the female, young, old, depending on their age. But I'll go by, in America here, the commonest one we use is a medication called Keppra. The medical name is levetiracetam. So this medication, we normally give it to people, 500 milligrams. It's a pill, twice a day, and if it doesn't control it, you go to 750 twice a day or 1 gram twice a day. It's very well tolerated, and many patients are on it, and it controls very well the seizures very well. Another one is medication called carbamazepine. Back home, we call it Tegretol. This is one that is also very common back home in Nigeria that is used to control seizures. However, for Tegretol, if you're on these medications, please work with your doctor to make sure they check your blood counts, because it could reduce, can cause some abnormalities in your blood cells. And also, to some people, it could be sedating. It could make you a little drowsy. Apart from this, there are so many other medications. There's one called topiramate, Topomax. This is also used to treatment of seizure. We have valproic acid. This is another medication, or sodium valproate. This is another medication that is used. If you're on this medication, work with your doctor to monitor your liver enzymes, because this affects liver enzymes. So, in a nutshell, there are many medications that could be used. Like I mentioned, some of them have some side effects to be mindful of if you're on them, but treatment, it could be treated.
Oh, viewers, today, I'm sure watching this program, you have gained a lot. I want to ask, Doctor, what would be your general advice to the public?
Seizure disorder is a medical condition. That is just simply put convulsion. Epilepsy is a syndrome, it's a diagnosis. When you have multiple seizures, then we say you have epilepsy. If you have a seizure disorder, it is not something you should be stigmatized or punished for. And it's not that you've committed some heinous crime or sin unto God that you're being punished. No, it's just a disease condition. See the healthcare professional to actually diagnose what seizure disorder that you have. We have all sorts of tests that we do. Blood tests, scans of the brain to know where is the problem coming from. And we have what we call EEG, electroencephalogram. This is a test of the electrical activity in the brain. This is what actually tells us where in the brain the problem is coming from, and then that can help us treat that. So it's not something you should be stigmatized for. If you unfortunately have it, there are effective and proven treatments for it. 80% of the time it can be controlled. Do not go off the medication without working with your doctor, please, because there's a high risk of relapse or this seizure disorder coming back.
Thank you, viewers. I think, Doctor, our time is up. Thank you, viewers. Keep watching ACNNTV, Anglican Cable Network. Its headquarters is in Abuja. But above all, do not leave the pew and the pulpit. Coming to you all the way from New York City, Anglican Church of the Holy Spirit here in the Bronx. If you find yourself in the Bronx, feel free to worship with us. Thank you and God bless you.
Thank you.
Hi, friends. I welcome you. My name is the Venerable David Nwanepe. I am the rector of the Anglican Church of the Holy Spirit here in the Bronx. If you find yourself anywhere around the Bronx, New York City, feel free to worship with us. We worship every Sunday, and we have our Bible studies every Wednesday. For Sunday services, we start our services at 11 a.m. and through 1 a.m. And the address, if you want to locate us, you will locate us at 3840 Seaton Avenue here in the Bronx. The zip code is 10466. 10466. To reach us by phone, you will reach us at 929-944-3424. 929-944-3424. For email us at anglicanchurchoftheholyspirit@yahoo.com or info@anglicanchurchoftheholyspirit@.org. Or you can as well visit our website at www.anglicanchurchoftheholyspirit.org. And feel free, call us, come worship with us. We worship every Sunday, and on Wednesday is our Bible study. It starts at 7 p.m. Zoom. You'll find our Zoom link here and also on our website. Or you can WhatsApp us. We're also on WhatsApp. Our WhatsApp number is 929-944-3424. 3424. That's our WhatsApp number. So reach us, contact us, feel free. For weddings, baptism, our church, we are open. So long as you walk in and accept Jesus Christ, you'll be baptized and you'll become a member of the faith of Christ. And if you are a member and you are married, feel free. We also offer wedding services. And there are so many packages, revival programs. So you are highly welcome. Thank you.